Pfizer says each experimental pill reduced the risk of hospitalization death from COVID-19. CNN drug maker Pfizer said Friday each experimental pill designed to fight the coronavirus reduced the risk of hospitalization and death from high-risk patients taking part in a trial of the drug. The company hopes that it can eventually offer the pill given in combination with the older antiviral drug called ritonavir to help to people to take at home before they got sick enough to go to hospital. A so-called interim analysis done before the trial was scheduled to end showed a 89% reduction in the risk of hospitalization or death from COVID-19 if a patient got it soon enough, the company said. The Pfizer released the result in the news release and did not provide scientists to discuss the data ahead of release. The data has not been peer-reviewed or published. The company says it will share more specifics in the peer-reviewed paper and with its submission to the U.S. Food and Drug Administration. The company has been testing the drug in adults with COVID-19 who are considered at high risk of progressing to severe illness. The volunteers have been randomly given either the pill combination or the placebo within 3 days or 5 days of their symptoms starting. The pill, still known by its experimental name PF 07073213332, is what's known as the protease inhibitor. It's designed to stop the virus from multiplying. Giving it along with the ritonavir slows its breakdown in the body, the company said. The Pfizer said 0.8% of patients who got the drug combination within 3 days were hospitalized within 4 weeks. 3 out of 389 patients, compared to the 7% of patients who got placebos, or 27 out of 385, and 7 of those who got placebos died. Pfizer said no one who got the treatment died within a month. Similar reduction in COVID-19 related hospitalization or deaths were observed in patients treated within 5 days of symptoms onset. 1% of patients who received the PF 073213332 with ritonavir were hospitalized through day 28 following randomization. 6 of 607 hospitalized with no deaths, compared to 6.7% of patients who received the placebo, the company said. It said 19% of patients given the treatment suffered this adverse event, compared to 21% who got placebo, but declined to disclose what those adverse events were. These data suggest that our oral antiviral candidate, if approved by regulatory authorities, has the potential to save patient lives, reduce the severity of COVID-19 infections, and eliminate up to 9 out of 10 hospitalizations. Albert Bourla, chairman CEO of Pfizer, said in a statement. Currently, Remdesivir, sold under the brand name Burklory, is the only antiviral approved by FDA for treatment of COVID-19. It's given by intravenous infusion, so it's not as simple to administer as the pill. People can also be treated with monoclonal antibodies, which are injected or infused therapies that kickstart the immune system to help fight off infection. They are not as easy to take as a pill and they must be administered by the trained professional. Maggie is seeking FDA emergency use authorization for mon- molnupiravir, an antiviral capsule people could take at home. It's been shown to reduce the risk of hospitalization or death by about 50%. On Thursday, UK drug regulators authorized molnupiravir under the brand name Lagevrio,